Interestingly enough, of all the horrors that the nurses saw and talked about in this book, and they talked about some really horrific stuff, they said the worst horror was that the patients were denied advocacy. They weren't allowed to have family, friends, legal representation. If nurses tried to advocate for them, the nurses were shut down. You were literally on your own. And this is really unprecedented. Chaplains were not allowed. Spiritual people were not allowed. Nobody was allowed to see these patients once they were designated patients. And that's kind of where this whole assembly line to death began. As you probably remember, everyone was being told they had to be tested for every day. Every time you turned around, you needed another test. Yep. Because the system was desperate to get as many cases as possible because they got paid for every COVID case they identified. And of course, the test was nonsense. And, probably this, I'm sure once the science is done, they'll find out that there are 100 things that could trigger a positive test, not least of which, of course, is ramping up the cycles on the test itself, right? But they were desperate to get the test. And then once you were positive and you were in a hospital and hospitalized, you now entered a alternate medical reality.